As the number of Alabama COVID-19 cases climbs to nearly 16,000, cities across the state are struggling to keep up. But Madison County officials say that this area is proving to be something of an anomaly. Our Sydney Stallworth gives us the latest about the county's fight against the virus.
I can't tell you why there's a difference between our numbers and the state. I only know that our numbers we're very comfortable with. We're very comfortable with the numbers that I'm presenting to you relative to the test that we performed.
Reporters asked if some patients from places like Montgomery or Birmingham could be transferred to Madison County hospitals to fill the need for ICU beds.
Unless the numbers just start doubling and tripling from where we are today, I think as a state we'll be okay. We'll distribute the patients as needed.
After observing the community over Memorial Day weekend, Mayor Battle says safe practices are paying off.
There were a lot of people out there with masks, wearing those masks, staying separated.
3 months ago today, the county held its first COVID-19 update, and there's still so far to go until a vaccine is developed.
The end is not totally in sight, but we are going to have an economy, and we're going to walk that fine line of opening an economy and also making sure that our public is safe.
And people could be feeling the effects of an uncertain future.
We have a pandemic fatigue in our community. People aren't willing to do what they were doing 30 days ago.
With over 20 remote testing sites established and a new antibody test offered at Huntsville Hospital that's available to local physicians, testing availability is increasing. But Huntsville Hospital CEO David Spiller says a lot of resources are used on those without symptoms.
Tested close to 1,000 asymptomatic patients, and we've had one test positive. So clearly not the best use of testing.
He urges people to only seek testing if necessary. Putting the Valley first, Sydney Stallworth, WZDX News.